Obviously, when you're in dental school, you're getting out, you're scared, you don't know. Obviously, you want to make money.
Is that dentists have one thing in common, which is
how Benco and you guys do, or just in general, your advice for.
As I did more and more consulting, I realized I had a really love for this.
Are such an asset. Like, you're going to make them so much money.
The quicker you can get to that, the better off you are.
ADEC's Smart Start program offers first-time practice owners their deepest discounts on equipment and furniture for 2 years, plus other savings and complimentary services. Ask your ADEC rep for details and start smart with ADEC. Join Doctors Savannah Craig and Renetta Sartor as we navigate life beyond graduation. Real conversations about forging our own paths in our early years in our careers. There's a reason it's called practicing dentistry. Welcome back to a very special episode of Beyond Graduation. I am Savannah Craig, and with me as always,
I'm Dr. Sartor.
So this episode is super special because it's our first episode with two guests. We've got some team members from Benco hanging out with us today, so we'll give them a chance to introduce themselves. Dr. Mark Fleming, tell us a little about yourself.
Yeah, hi. I'm a dentist. I went to the University of Washington Dental School. I've practiced clinically for about 10, 15 years. And then now I work as a practice transition consultant with Benco. And so I've been doing practice transitions, valuations, career planning for about 20 years now. So I have had a journey that started clinically and has now ended up here into practice transitions. And I help with Benco. I help dentists from all around the country just kind of plan their career, help them from the beginning to the middle to the end, buying practices, selling practices, mergers, startups, associateships. So you kind of pretty much everything, all the possibilities from A to Z, and help them, get through their career that way.
Awesome. You're going to be the perfect wealth of knowledge for us today. And then our second guest today, KJ, tell us a little bit about what you do with Benco and how you got into everything that you're doing.
Sure. So really we focus on the milestones of a dentist career, right? So from a student to, hey, maybe it's time to grow and expand, or maybe it's time to exit plan, or, hey, I'm post-transition, but I'm not quite ready to be done with dentistry. Can you help me? So any of those milestones throughout a dentist career, we have something here that it obviously can help them. And my previous background was in restaurants, and from restaurants I transitioned into operations, and I have a business degree, so like I'm passionate about how metrics correspond to behaviors. So I'm very fortunate and lucky to get to work with, top talent like Dr. Mark Fleming, and we have a lot of rock stars on our team, and we just really care. I think all of us have the same thing in common, is we want our dentists to be successful, our customers to be successful, and how can we help them do that with high ROI products or services? So I think we all sing the same song, maybe not well, but we mesh well together. That's for sure.
That's awesome. I feel like as dentists, we had the milestones of getting out of school, going to dental school, finding our first job, and then maybe getting to become a practice ownership. But beyond that, as you guys have stated, I think we're kind of lost, especially in those next milestones and transitions. So it's awesome that you all offer services to dentists in that way.
So when I think of Benco, I think of them as a supply company, but you all are telling me that Benco does so many more things. Will you speak a little bit more to that?
Sure. I would say we have several pillars within our organization. So we have our merchandise, which some of that is our own brands, which are very popular. We also have equipment, right? And then we also have services, and services kind of flows into two buckets. One is the things that Mark and I do and our teams do. And then we also have field service techs that go out and help support the dental equipment that's purchased. So again, anything to help deter the office being down or something not working. Like, we really want to take away those stressors. So we're very lucky that we're part of this family owned third generation, about to be fourth generation company, but also are able to all work together within those four pillars to provide the best experience for our customers.
Very neat. Mark, can you speak to the transition from clinical dentistry to what you're doing with Benco and how you found that as a path and what that's been like for you?
Yeah, it it sort of happened accidentally.
As all
We'll
the
start
best
with that.
things
Yeah,
do.
no, so I was practicing clinically. I had my own practice, and that's was going fine. I had an opportunity to try consulting just on the side, and I did it, and I realized, oh, I kind of like this. And so one thing led to another. It sort of snowballed, and pretty soon I was doing two full-time jobs. I was doing my clinical side, and then I was doing consulting. And so obviously, as I did more and more consulting, I realized I had a really love for this, and eventually had to pick between the two. So I decided to get out of the clinical side and just focus on the consulting side. And I've been doing that ever since. And I think, my journey is maybe not typical, but I think it's a kind of important because too many dentists think that there's only one way, like in your career, you got to follow this prescribed pathway. And the reality is you don't. You need to analyze what your goals are, what you're looking for in life and career. And there's so many different pathways in dentistry nowadays, and so many different ways you can and do this. And mine's just one example of maybe a non-traditional pathway, but there's so many different things, and we can dive in deeper on this topic, but that's why it's important to kind of do career planning. So start by laying out your goals, where you see yourself in 5 years, 10 years, 20 years. What do you want to accomplish? And then from there, dig into like what would be the best pathway to get you to those goals. And it will be different from everybody else. There's a lot of things that are the same. There's the recipe can kind of be the same, but the pathways are different for everybody.
KJ, speaking to those different options, this might be a controversial take. Do you have a favorite era of dentist? New grad, dental student,
oh gosh,
associate, like post transition? Do you have a favorite?
Oh gosh, that's a tough question. And I'm not trying to be safe by any means, but I think there's something interesting in each pathway. And what's cool for me, something that Dr. David Rice and I talked about the other day was, what's the psychology? What are the stressors that each of these groups of folks have? And like, what solutions do we have or can we provide to help eliminate those stressors, right? How do we make this easier? How do we truly partner to help them be successful in whatever milestone or part of their career is? So, I mean, I think there's difficult people in every single one of those groups, but there's also really magical people in those groups. So I think it's all just kind of a pleasure, because the one thing that I've realized, I talked about restaurants a little bit, is that dentists have one thing in common, which is it's like this service, right? You want to provide a service, whether that's to get somebody out of pain, rebuild their confidence, whatever that is. And so that really ties into my past and my passion. And so I know that feels like such a safe answer, but it truly is. I love the challenges of each group. And I also love the people who are just like, yeah, let's go get them, Tiger.
Yeah.
It's just, we're lucky and we're fortunate, and it's so much fun. I love what we get to do every day.
That's awesome.
I know one question that the listeners may have is, how do we find a Dr. Fleming or a Dr. or KJ? Like, do we just look up who our, regional or local Benco rep is and they put us in contact with you all? Or are you looking for a job?
But not just any job, a really good job.
And by job, we mean in dentistry, of course.
And a job in dentistry could be an associateship, starting your own, or acquiring a practice. There's a lot of ways to be a dentist.
If you're looking and you've been looking, Ignite DDS coaching is the way to go.
Take a look at ignitedds.com. We've got all of the resources to find the perfect dentist job for you.
How does that work?
I mean, we will provide, we put out advertisements with our cell phones. We're not trying to hide from anybody. We're trying to be available. So like, if you have something we could post, we're more than happy to do that and provide like our business emails, all that stuff. But we work very tightly and closely with our local reps, because I mean, they're the feet on the street. They're the ones with the relationship. We're just trying to strengthen it.
How would you guys say that you, or how Benco and you guys do, or just in general, your advice for a new grad or a dental student to get that first job and to prepare themselves? Because it's hard to know what's out there and what is a good fit for you. And let's be honest, we're all like, please just pay me so that I can pay my loan. But I think you have to think a little bit beyond that.
And we
Sure.
kind of were joking about it before we all got on with Dr. Fleming about how we don't know what we don't know. And so I think that ties back into what Savannah was saying just now.
Yeah, I
Mark, I
think
think that you could answer that the best because you do
yeah.
the
So
post transition and prior.
yeah, and I've been there. I've
Yeah.
That's
been
what
in
I
that
mean.
same
I think this is for
situation.
you.
So I know there's so many layers to that question. I think that obviously when you're in dental school, you're getting out, you're scared, you don't know, you obviously want to make money. You think you may feel pretty good about your clinical skills, but you don't feel good about your business skills. You don't really know exactly what to do. So I would tell people my biggest advice, again, back to the career planning, not to overemphasize this, but the first thing to do is figure out where you want to be. What are your goals? Really, to be you could do it prior to even looking for your first. You do it when you're still in school. I mean, like, where do I see myself? What do I want to do? Most dentist pathway, if you were to kind of graph it out visually, it would look like the first third of their career is sort of like a growth phase where they're slowly growing, and that could be as an associate, it could be as a practice owner, whatever situation they're in. They get about a third of the way through the career, and if they're like mostly if they're an individual practice owner, they'll eventually hit a peak. Like, I'm doing as much dentistry as I can do in a week, in the week that I want to work. And so it sort of levels off. And then you have about a third of your career where your income and revenues are about the same. And so they kind of are plateaued. And then you get the last third of your career where you stop, like, oh, I don't like doing molar endo. I really hate it. It ruins my day. I'm referring that all out now, or whatever it is for you. I want to, instead of a 5-day work week or 4-day work week, I want to work a 3-day work week. I want to take more vacation. And then you start going back down the backside. So it's sort of an up, flat, and then back down again. The reality is, I mean, we should not be following that pathway. That should not be what the graph looks like. And too many dentists in the beginning take too long to figure out what their trajectory is going to be and what their pathway is going to be. And it's because they have these barriers in their mind. They think that they don't have the experience. They don't know how to run a business, or can't get financing, or whatever it is. So if their goal is to be an individual practice owner, the quicker you can get to that, the better off you are. Because otherwise, if you just spin your wheels 5 years as an associate, and that's not your goal to be an associate, you're just doing that to fill the time or to quote unquote get more experience running a practice. The reality is, you as an associate, you really don't get the experience running a practice. You improve your clinical skills, but you're not running that practice. So you're not learning those things. So there's other ways to do that. If you're buying a practice, an existing practice, you're buying it so that it has all these things in place. There's already staff in place that run things. There's systems in place. So you don't have to start this all from the ground up. There's also
Mm-hmm.
there's so much professional help out there to help guide you through this. Like at Benco, we have practice coaching and things like this that will walk you through and hold your hand and help you through this. You do not need to be an expert at business to own a business. You just need to have a good people around you to help you through that process. So anyway, the faster you get there, the quicker you're going to get to where you want to be. And then when you get to that flat part later in your career, there's things you can do to not stay flat, so you can keep growing. And then you can maybe retire 10 years earlier than if you had done another pathway. So there's a lot of good things you can do right from the beginning, and there's not enough thought put to that. It's like, oh, I just got to get out. I got to make some money. I got to take any job that I could find, instead of like, is this associateship job that I'm taking, is this moving me towards my goal, or is it just working for a paycheck?
Yeah.
Because every associate job is so different. I mean, some will be very good and very lucrative and help you get where you want to be, and others are just like you're doing hygiene checks all day long, and it's not helping you at all.
No, that's such a good point.
I have a really good question based on what you said. Do you think, because there are some listeners out there who in no shape or form wants to go the ownership path, do you think, or what do you think it needs to look like for someone to be an associate and reach the level of success that maybe you could quicker on the path of ownership.
Yeah, I think it's kind of this. It's still the same general concept. Whether you don't have to be an individual practice owner, you can certainly work in a group practice. You could be an associate your whole career if that's your goal. That's totally fine. Everyone has their own pathway. But again, like I said, there's many different kinds of associateship. So again, it's identifying, hey, if I want to be a career associate, and let's say I want to live in this city, then okay, if that's important to you, those are your goals, then it's about identifying opportunities that will fit into that structure. So many associateships out there are created by individual doctors. Now, I'm not talking necessarily the corporate and all that sort of thing, but like individual doctors say, I want to hire an associate. Well, the ugly truth of that matter is that most of those doctors that's saying that also aren't having professional guidance. They don't really know what they're doing. And it's kind of a knee jerk reaction that they're saying, I want an associate because like, okay, why do you want an associate? Well, my practice isn't busy enough, so I want to grow my practice. Okay, well, that's the exact opposite reason to hire an associate. If you're not busy enough, you're going to bring someone else in. What do you think they're going to do? They're going to sit around and do nothing all day. So it's important to assess what the situation is and do due diligence. I know it seems really weird. Like if you were like asking for a job, you're just like, oh my gosh, please give me a job. Please give me a job. But the reality is you need to know what's going on behind the scenes at that practice before you decide that that's where you want it to be. Otherwise, you're going to be there, and 6 months later, you're going to be leaving that for some other opportunity, and you sort of just wasted that time. So by due diligence, I mean you're going to want to look into some of these things, and this is where again having some professional help could be valuable. That we can, like for us or there's other people that do this sort of thing that can help you dial in. Okay, ask for a couple reports, a couple metrics, talk to some of the staff and before you commit to this, because there could be more going on here than you think.
No, that's 100%. I do a little bit of teaching at a residency program in Cincinnati, and they're all looking for jobs. They're going to graduate here in the end of June. And they're like, I don't know, like they said they're going to pay me, and like that sounds great. And I was like, guys, like you are such an asset. Like you're going to make them so much money. You have the power in this situation. So that's such a good point, to not just be like, thank you so much for the job. I will do whatever
Right.
you want.
Right. Right.
KJ, for you, since you're not the outsider, but you don't have the dentist brain like we all do. Do you have any insight on why dentists are like that? I feel like we come out of school and we're like kind of beat down, and to Mark's point, we don't want to ask for professional help even once we've been a practice owner. Like we're all just out here on an island, and we're the first ones to be like, I know nothing about business, but I'm not going to ask anybody, and I'm just going to struggle here for forever. Do you have any insight on why we tick that way, and how to get us out of that?
I feel like it's like a generational I feel like it's like passed down. It's like, you get like a family rhinestone. I don't know, that's a terrible example, but like there's something that just continues to be passed on. And so it's this mindset, right? Like even if you wanted to be an owner, for example, most people in a dental transition is trying to be an owner do not seek professional help even to purchase a practice. I've never purchased a home without a professional agent who can help me. You know what I mean? And it's just this mentality of like, there are people around you who want to help you. And there's even case studies within our organization of people who started with like coaching prior to ownership or associateships in that placement and getting consulting from people like Dr. Mark Fleming, or we have Damari on our team who's a hygienist and understands that mindset. And we see a significant increase in EBITDA, cash flow, and success when you have that support at the onset. So we're trying to make it as simple as we can. But genuinely, I feel like it's just like this passed down mindset. And it's like, it's okay, but we need to like be a little more open-minded and realize there's people around you that really want you to be successful.
Yeah. To that point, how do you find those people? Because there are also people, I don't know if you guys are in the Facebook groups, but there are some people out there who are trying to take advantage, especially of new grads and young doctors. So how do you vet your team and get awesome people like KJ and Dr. Mark on your team?
Are you asking how we hire top tier talent? Or are you asking how do we
As a
find those dentists who are looking? Sorry, I
No,
misunderstood the
you're good.
question.
So like for me as a young dentist or a new grad,
Sure.
how do I find the people on my to get them on my team that I can trust to help be the experts in those moments?
So like a Dr. Mark Fleming or a me
Yeah,
partnering.
how do we
Okay,
find you?
understood. So I think, well, it sounds like we need to do a better marketing job based on what you just said, because earlier you said something, you both alluded to, hey, I thought you just sold merchandise, right? Like you
Yeah.
didn't even know.
Yeah.
So things like this, I think, are helpful. I do think we have an incredible marketing team. This is not a dig at them, but like Facebook groups, I think, Mark, you've taught me this. It's some of those are kind of exclusive, right? We may not have access to them.
Yeah.
Where I think that kind of eliminates some of this help that could be there. So really, that might actually just be like access.
Mm-hmm.
And so we can cut out the marketing comment then, but just access to those groups, right? It's really not. But then also like doing things like this to really open up the eyes of people who are attending. Like I just got back from Chicago Midwinter, like just being accessible, right? Or study clubs, we do things like that. And I think also just providing our contact information after this. Mark and I do a lot of speaking events and to try to engage dental students, associates who are seeking. So we just probably need to be louder and get more access and figure out how to work together better. And maybe you guys will provide us some professional help by the end of this. This might.
Yeah, I mean, I think like we're just stuck in the profession is stuck in this just mindset where you you graduate dental school, either go to a residency or take an associate, whatever you find. You do that for a number of years. And this is taught to us in dental school too. I mean, it's the way it's always been. It's not like a new generational thing. This is the way when I was in dental school it was. Oh yeah, we don't teach you anything about business or anything else about your career. It's just about clinical skills. And some schools are slightly a little tiny bit better, but still they don't teach you enough to make you feel confident. So, and it's part of the industry too has been professional representation was only for practice owners. So once you already owned your practice, right? But then what about before that time? And there just hasn't been much in the market over the last several decades for that. Now there's some options now, but I would say absolutely you need to have professionals helping you. And obviously you need to vet those professionals, like when you're picking who it is. I mean, it needs to be a reputable company, a company like Benco. We've been around a long time, we have a great reputation. There's others out there too, but just don't just because some person in your area says, oh yeah, I could help you, I could do this. Well, I would look into what their qualifications are, who they've helped, and not just get taken for this. And the other thing is, this does not need to be expensive. That's the other barrier. As students, we don't finances are a huge issue. And you're like, oh, I can't afford to pay consultants; they're so expensive. Well, I know I can't speak for other services out there, but our services are very inexpensive. Our services, like if you're looking to help in purchasing a practice, we have buyer services in different tiers, so whatever level you need and the different costs. But the least expensive one is $1,000, and then the one that's inclusive of all the services only $5,000. So you're going to buy, like say, a $700,000 practice, and $1,000 to $5,000 in costs to help you through the process or decide if this is right is so nominal. You don't need to spend $100,000 to have a team on your side.
And one quick call out there, because you teed it up really well, Mark, is what's really interesting about our time now with dentists is banks are now approving a lump and sum. So like if you wanted to add a service to help better your business, you can lump that into your loan if you were purchasing a practice, like Mark was just saying at the end.
That's true.
And that's never happened before. So it's really an exciting time.
Right.
That's
so
huge.
that could be all part of the financing for your practice acquisition. Correct. If that's the way you're going. And at Benco here, we also have a number of just free services too that don't have any financial tie to them. So don't let finances be a barrier, I guess is what I'm trying to say, because they really shouldn't be.
Can you all speak more to how practice models and just the practice of dentistry in general has evolved? Because you kind of mentioned, KJ, how banks are now seeing okay, it's going to benefit the business more to give them some money on the front end to kind of help grow that. So, what are some other things that you all are seeing that's evolving in a good way to help the future dentists and current dentists?
The few things I can think of off the top of my head are bank loans are now also bigger, which is a sign of, hey, we're evolving with maybe inflation or maybe these other things, or realizing how much debt you're incurring now, which is significantly larger than 10, 15 years ago, 20 years ago, whatever that time frame is. And then there's also some really incredible people who can do fee negotiations and credentialing. And people don't think about this. And you really should pick somebody, like Mark said, the finances should stand in the way, but also, is it somebody who's trying to take a percentage of the revenue that you create and produce? Or is it somebody with a flat fee that really just wants to see you get that high ROI? So there's really unique things that are overcoming these these consistent things that haven't changed since like the 50s. When you look at benefits and you look at, the price of a crown now, well, if I get one crown, I've exhausted my benefits already. And that hasn't changed in many moons. And that's where you see these companies come in and kind of resolve that issue. And those are two really exciting things that I'm saying. I'm sure there's a bunch more that are going to hit me like a train after we hang up this phone call. But those are just two that immediately hit me. Mark?
Yeah, no, that's like the fee negotiation, PPO fee negotiation is critical nowadays in practices. Since so many of our patients are tied to PPOs, you can't afford to have a reimbursement rate that's like 40% of your regular fee. And you don't need to, because a lot of these companies, you can negotiate that up. So instead of 40%, now you get up to maybe 80%. And so now maybe economically it makes sense, but it doesn't make sense to treat them at 40%. So that's one thing. There's also medical billing. That's a whole nother really hot new area now where we can get significantly higher reimbursement rates and coverage on things that were never covered by traditional dental insurance. Like KJ was mentioning, you max it out. If you have to do a larger case, well, you'll max out your insurance max, the patient will, the first crown that they do or first implant. And so there's other ways to tie that to medical billing. So there's a lot of things that are changing, and it can be, again, you don't need to be experts at all this. You just need to have a team that knows these different areas and can help you through it. And those type of things pay for themselves many times over, for sure.
Thank you for joining us for this episode of Beyond Graduation. If you enjoyed this week's episode, be sure to share it with a friend. Connect with us on social media at Savannah Craig DDS and at Dr._Sartor. And remember, you are not alone on this journey.
ADEC certified pre-owned equipment is a sustainable, affordable choice that makes genuine ADEC equipment available to every doctor. Each package is sold on a first-come, first-served basis. So, if you see one you like, contact your dealer. For more information, go to www.adec.com/find a dealer. Thank you for listening to Beyond Graduation, brought to you by Ignite DDS and Future Dentists. This episode was sponsored by Ignite DDS Coaching. We build self-determined futures. For more information, please reach out to the Ignite DDS team.